Ever heard of cluster headaches? These are no ordinary headaches. They're a league of their own, often described as one of the most painful types of headaches a person can experience. They're called cluster because of their tendency to occur in groups or cycles, hitting you with an intensity that's hard to ignore. Unlike your typical tension headache or even a migraine, cluster headaches have a unique pattern. They strike quickly, usually without warning, and the pain is severe, typically felt on one side of the head and often accompanied by restlessness or agitation. Many people often mistake them for migraines or other types of headaches due to the severity of the pain, but their unique characteristics and patterns set them apart. They're not just another headache, they're a medical condition that demands attention and understanding. Now that we've got a basic understanding of cluster headaches, let's dive deeper into the symptoms. What does a cluster headache feel like? Imagine a pain so severe that it feels like a hot poker is being driven into your eye. This pain typically settles on one side of the head, often around or behind the eye. The eye on the affected side might become red or teary, and you might notice a runny or blocked nose. This is no ordinary headache. This is a cluster headache. The pain is so intense that it can disrupt your daily activities, leaving you restless or agitated. Unlike a migraine that might make you want to lie down in a dark room, a cluster headache often compels you to pace around or even rock back and forth. The attacks can last anywhere from 15 minutes to 3 hours, and they often occur at the same time each day. It's like an alarm clock of pain that you can't snooze. Now that you know what to look for, let's talk about what causes these debilitating headaches. What causes cluster headaches? That's a question that has puzzled scientists and researchers for years. The exact cause is still a mystery, but it's believed that changes in sleep patterns and a malfunction in a part of the brain called the hypothalamus play a significant role. This tiny part of the brain controls our body clock and releases chemicals that signal pain to the body. In addition to this, certain lifestyle factors and triggers can set off a cluster headache. Consuming alcohol, even in small amounts, can trigger a headache during a cluster period. Smoking is another common trigger, and certain foods, particularly those high in nitrates, can also set off an episode. But remember, these are just triggers, not causes. They can kickstart a cluster headache, but they don't cause the underlying condition. Understanding the causes can help in managing the condition, but how is a cluster headache diagnosed? How are cluster headaches diagnosed and treated? Let's delve into that. The diagnosis of cluster headaches largely depends on the symptoms and medical history. Doctors generally rule out other potential causes of headache before landing on a diagnosis of cluster headaches. They might ask about the frequency and duration of your headaches, your pain level, and other symptoms that accompany the headaches. Now, let's talk about treatment. Oxygen therapy, where you breathe in pure oxygen through a mask, can often help alleviate the pain. Sumatriptan injections, a type of triptan medication, are also used to treat acute cluster headache attacks. And then there are preventive medications like verapamil, a type of calcium channel blocker, which are taken to reduce the frequency and severity of the headaches. Remember, if you have severe, recurring headaches, it's important to see a doctor. It could be a cluster headache, and there are treatments available to help manage the pain.